Americans are grappling with a second pandemic Christmas this year, and although the CDC says the virus poses less of a threat this year than it did last year, it's still causing many to wonder if traveling is safe. AAA predicts 109 million people will travel for the holidays, a nearly 34% spike from the last year. But that estimate was compiled before December 14th and the recent spike in cases. People still intent on traveling are being forced to wait on long testing lines like these. Here's the CDC director giving her guidance earlier today on how to stay safe while traveling.
I also want to be sure people understand the risks around holiday travel. Holiday gatherings and risk of travel really has less to do with the airplane or car ride and much more to do with how people from different households behave in the weeks to days before meeting up. Importantly, consider gathering with family and friends who are also practicing similar proper prevention measures. And I would encourage people to take an at-home COVID-19 test ahead of time to help protect you and your family and friends who may be at greater risk of COVID-19 or severe outcomes.
The virus is clearly impacting so many families right now, and there's no doubt it will cause many travel adjustments. My own daughter was supposed to visit me for Christmas, but she has just tested positive, and it came back, she tested positive in New York, so she will be self-quarantining at home this year in Brooklyn. But with the magic of Zoom or Skype, we will still be together. And my daughter, Iman Blow, is here with me tonight, making her exclusive BNC Prime debut. Iman, how are you?
Good evening, Charles. I'm doing a lot better than I was earlier today.
That's good. So let's learn a little bit about you. So you are an elite athlete. You're a fencer. You've been very careful because you have to stay healthy in order to be able to compete in the fencing tournaments. You are vaccinated, and yet you still contracted COVID-19. What message do you want to give to people who are on the fence about getting vaccinated? They look at this case and they say, even if you got vaccinated, you still get it. What is the message you think for young people like yourself as it relates to the vaccine?
Yeah, definitely. So for me, taking the vaccine had to do with kind of a personal responsibility and being very community oriented. So I've been a part of a lot of communities and been a part of a lot of teams my entire life. And I knew that, if maybe I was going to stay inside for the 2 years since the pandemic started, maybe I, didn't need to get vaccinated. But as soon as I knew that I was going to make the decision to be around other people and to go outside, whether it's in a public space or in a private space, for me, it's not only my own health that's at risk if I were to contract COVID, but it's other people as well. So to protect myself, but also to be mindful and cognizant of my community members, it was important to get the vaccine.
And what did the doctors who tested you say to you about your likelihood of getting severely sick because you are vaccinated?
So I took an at-home COVID test at first, and it came back negative. And when I went to the emergency room, it was kind of hectic, honestly. It was yesterday or 2 days ago, and it took like 2 hours to get the test. And I was checked in with a doctor after I got the test itself. And I didn't have, at that point, very bad symptoms. But they just sent me my results back, and it had a standard protocol of quarantining. So there was no extensive evaluation. It was just the mandate to quarantine at home and to not contact other people for the next 10 days at least, or until fever symptoms or other symptoms went down.
Is there a larger message here for you? I'm in Atlanta, you're in New York. Omicron is raging in New York. It is not raging to the same degree in Atlanta, although it has surged enough for the mayor here to impose new indoor mask restrictions. But if you see it raging in your city, do you believe, the proper community protocol? What do you do to be a good citizen, even if it's not, like you said before, it's not necessarily just about you not getting sick and dying, but how do you become a good citizen in the age of COVID?
Well, I know within the past month, there's been a lot of mass events in New York. So there was Comic-Con, followed by I think it's like Santa Con. And I remember I trained near 34th Street and I saw loads of people maskless running down the streets in Santa outfits. And also, I know, Columbia University has had a lot of cases as well. And I know they just finished finals. A lot of people, I attended there after finals. People love to party and release stress. And I would just advise if it's not a mandatory outing, which nothing really is a mandatory outing, just not congregate in large masses. I know mental health has also been a big component of this pandemic. And I've definitely seen one or two friends at times just to keep that community connection, but definitely not gathering in mass and gathering in mass without masks, just to be mindful of others in your community.
Let's talk a little about mental health. You do a lot of work around mental health in sports and helping people to navigate that space and stay mentally healthy. What is the mental impact that your friends are dealing with right now with COVID? Whether or not they have it or not, just the seesawing, the going back and forth, the feeling like it's going to be over and then it's not over. What is the mental impact of your generation as you can see it as reflected through your friends?
Well, I think there's kind of three things. One thing, the first two within the athlete community, a lot of people have experienced like anxiety. I've just talked to my friend today who's just constantly anxious about getting COVID, not only because of what the physical consequences could be, but if any of us athletes get COVID, we cannot compete. And the season is so demanding that if you can't compete in one tournament, you might be knocked out for the rest of the season in terms of being able to be eligible for continuing to compete. Another thing or kind of experience that people have are like depressive symptoms, not being able to be around your communities, to engage in similar activities, being isolated inside of your home can be really hard for people, particularly during winter months when it's super cold. And it can be very lonely. So that's been another thing, especially if you're like in sports, particularly like taken away from that
Hmm.
sports environment and really uncertain about
Right,
it. And then the third thing
right,
is people just being tired of it, right? I think a lot of young people feel
right.
like, oh, okay, I've done this quarantine thing for long enough, and now I'm just going to live my life because this is our
Right.
reality, which may be true, but it can be a dangerous mentality when there's things like Omicron and more variables coming around.
Iman Blow, thank you so much for joining us tonight. And I'm going to put on my dad hat and say, get some rest, get better. Love you. Take care of yourself.
I got my water.